They are often the forgotten population, those experiencing homelessness. So while we might be able to self-isolate at home, these folks don't really have a choice.
That's right. And today and for many days to come, staff with Unity Healthcare will hit the streets to screen the homeless for coronavirus. And Megan Rivers is joining us now at a D.C. shelter with more information. Hey, Megan.
Good morning, Annie and Tony. Every night, thousands of people come to this shelter right here in D.C. because they have no place else to go. The CDC is warning people not to gather in larger groups of 10 to avoid contracting and spreading the coronavirus. But for those experiencing homelessness, they have no place else to go. Now, Unity Healthcare is doing their part to ensure those who are experiencing homelessness are able to get screened.
I just believe in my God that I'm covered.
He goes simply by LB. He spent 20 years living on D.C. streets before getting a home.
About 4 years, and I'm happier than I ever have been.
He comes back to one of the same spots he spent many days and nights.
One day I'm here every day.
He's getting screened for the coronavirus by Catherine Crossland, the director of Unity Healthcare.
We'll be asking about fever and cough and shortness of breath. We have masks in our bag, surgical masks in our bag that we can offer to folks if they are coughing.
Crossland says the spread of the coronavirus is making this population more vulnerable.
For me, I feel like this is the perfect example of why housing is healthcare, because if everyone who's homeless in DC had a place to go and self-quarantine or protect themselves from being exposed to this, then we wouldn't be so worried about this population.
As for LB, he didn't show signs of needing to be tested for the coronavirus. His blood pressure was just a tad high. He's hoping now to spread the word to everyone he knows who might need more help, and that we all can focus on what he calls the true disease.
What are we really going to do about the homeless disease? Because when all this over, the homeless disease is still here.
Well, one thing to note is that shelters are staying open for extended periods of time. Where they once were asking people to leave during the day and then come back at night, those shelters are staying open right now. Another thing to note is that many of the shelters have clinics inside. So if you are experiencing homelessness, you can come to the shelter to get screened. Reporting live in Washington, D.C., I'm Megan Rivers, WUSA 9.